Good afternoon, everyone. It's now been 2 weeks since most educators, staff, and students across the province returned to the classroom to resume in-person learning for this academic year. We've made incredible strides as a province to get to this point where our children and youth are back where they belong, learning and socializing in the classroom with their friends and participating in extracurricular activities. These are all crucially important for the mental, physical, and social well-being of our children. I know the return to school was met with some nervousness and apprehension, and I want to thank our children, the staff, the bus drivers, teachers, and parents for working together to make the return to the classroom as safe and comfortable as possible. Now that school has resumed, I know that many of you are closely following the numbers of COVID-19 cases associated with the schools in your area. As we see during the influenza season every year, transmissible respiratory viruses do impact our schools, and certainly COVID-19 is no exception. Over the first few weeks of the school year, there have been 1,046 confirmed cases of COVID-19 amongst students and staff who attend school in person. But with over 2 million students and over 300,000 education workers and school partners and 4,844 publicly funded elementary and secondary schools in the province, this is not cause for alarm, and in-person learning continues to remain safe. We are monitoring this situation very closely, and as expected, most cases are contracted in the community and not in the school themselves. When cases do occur in school, transmission to date has proven to be minimal, with the majority of outbreaks contained at 2 to 3 cases. This is thanks to the school community following the public health measures, as well as rapid response from our school boards and public health units. We prepared for this and have taken the precautions and actions necessary to ensure schools remain open for the entire year with minimal disruption for staff, students, and families. Face coverings are worn in indoor settings. Hand hygiene, respiratory etiquette, and enhanced cleaning practices are frequently reinforced. Improvements to ventilation have been made. Physical distancing and cohorting is occurring as much as possible, and students, teachers, and staff are screening for symptoms every day. And when it comes to symptoms, I want to remind parents and students that the COVID-19 screening guidelines for schools and childcare have been recently updated. The symptoms most commonly associated with COVID-19 amongst children and youth include a new fever or chills, a cough that is new or worsening, shortness of breath, nausea or vomiting, or decrease or loss of taste or smell. If your child is experiencing any of these symptoms, they should not attend school in person, should self-isolate immediately, and seek testing as soon as possible. And if your child is experiencing any other symptoms of illness that are not included on the COVID-19 list, such as a runny nose or sore throat, it's still important to keep them home until symptoms are improving for at least 24 hours. It's also important to remember that there is not one specific measure that will prevent transmission from occurring in schools, which is why we have put multiple layers of protection in place. However, the key to keeping our schools open and as safe as possible is to achieve the highest immunization rates we can and to increase our level of community immunity and protect those who cannot receive the vaccine. Overall, as a province, 85.2% of eligible Ontarians have received 1 dose of a COVID-19 vaccine, and 79.2% are fully vaccinated. With respect to our school-aged children, we've had great progress vaccinating youth aged 12 to 17, with 79.1% having received a first dose of a vaccine and 68.6% receiving a second dose. But it's not only our younger kids that have returned to the classroom. Our post-secondary students are back on campus, and with only 68.8% of those aged 18 to 29 fully vaccinated, I want to encourage our young adults to continue to get immunized. I know that Ontario's post-secondary education institutions have been working hard to ensure their campuses are as safe as possible, and I want to applaud their incredible efforts. I continue to urge everyone to come forward, get vaccinated, or get your child vaccinated if you have not done so already. It is not too late. There are over 640 vaccination clinics in or near publicly funded elementary, secondary, and post-secondary schools working to support increased uptake and provide accessible and convenient access to vaccines for eligible students and their families, as well as educators and school staff. For those who still feel hesitant to be immunized, I encourage you to discuss any concerns you may have with your pharmacist, your doctor, or trusted healthcare provider. The immunization strategy is key to protecting ourselves, our loved ones, and our most vulnerable. I know that there are many students, parents, educators, and staff that may still be anxious and worried about the returning to in-person learning. Please know that my team and I are continually reviewing the data and will provide advice on any additional public health measures that are needed to protect the health and safety of Ontarians and keep our children in the classroom. After 2 school years already disrupted, we owe this to our children, youth, and families. I also wanted to take a moment to remind Ontarians that beginning tomorrow, you will be required to show proof of vaccination when entering certain non-essential business and settings. Please take the time to download and print or save your vaccine receipts to a mobile device, which then can be used as a proof of vaccination. Prior to entry into non-essential settings, establishments will visually verify your vaccine receipt to ensure that you are fully vaccinated, along with accompanying proof of identification. As this vaccine certificate program rolls out, please, let's all remain calm and patient. There will be a learning curve for everyone, so please be considerate of each other. Je sais que le retour à l'école, il y a 2 semaines pour recevoir l'enseignement en personne, a suscité de l'anxiété et de la crainte, et je tiens à remercier les enfants, le personnel, les conducteurs de l'autobus, les enseignants et les parents de leur collaboration à faire en sorte que ce retour en classe soit aussi sécuritaire et confortable que possible. Au cours des quelques premières semaines de l'année scolaire, il y a eu 1046 cas confirmés de COVID-19 parmi les élèves et le personnel qui fréquentent l'école en personne. Étant donné les 4844 écoles élémentaires et secondaires et les plus de 2 millions d'élèves, il n'y a pas de raison de s'inquiéter. Nous surveillons la situation de très près et tel que prévu, la plupart des cas sont contractés dans la communauté et non pas dans les écoles mêmes. Nous nous sommes préparés à cette situation et nous avons pris les précautions et les mesures nécessaires pour veiller à ce que les écoles restent ouvertes toute l'année avec un minimum de perturbations pour le personnel, les élèves et les familles. Et si vous n'avez pas encore été vacciné, je vous prie de le faire le plus tôt possible. L'immunisation est la clé pour se protéger nous-mêmes, nos proches et les plus vulnérables parmi nous. Merci.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
Your first question comes from Randy Rath from CHCH-TV. Randy, please go ahead.
Hi, Doctor. Now that we have the proof of COVID vaccine going forward in Ontario, do you think that enough people have been, has that stick had enough people get vaccinated, or are we going to need to do further measures to convince people that they need to be vaccinated?
Thank you, Randy. I think we'll have to monitor this situation very closely. We have had a rise in people taking their first doses as a result of this policy. I do hope it encourages others to come forward and be vaccinated. 85% is a great number for Ontario, but I certainly would love us to have the highest number achievable well into the 90s. We all want to move past this pandemic, and having the highest immunization rate possible will help us get back to a new normal. So we'll monitor the situation. I do hope over the coming weeks, as a result of this policy, that we'll continue to see people coming forward for first doses. There are other avenues for us to look at in terms of increasing first doses, and we would have to look very closely at the highest risk situations, such as where healthcare workers are taking care of vulnerable populations where we haven't had a high enough immunization uptake as of yet. But we'll monitor the situation. I'm just so thankful to all Ontarians that have come forward. 85.2% today is fantastic, but we all must reconsider, if we haven't been vaccinated, that staying unvaccinated increases your risk of getting COVID around 8 to 9 times higher than someone vaccinated. It's around a 20 times higher risk of getting hospitalized as a result of exposure to COVID, and around a 40 times higher risk of being in our intensive care settings. So to me, it's not just about getting vaccinated, it's preventing harm, it's preventing injury, it's preventing an impact on the healthcare system. And the higher the immunization rate, the higher we can protect our communities, protect our health system, and over time, reduce public health measures.
Follow-up?
Do you think that there's a possibility that we could see a surge in cases in a couple of weeks due to interactions, due to campaign events and crowded polling stations?
It's a possibility. I did vote yesterday, and they had distancing, they had masking, they had good hand hygiene available. And so I think they took the appropriate precautions in the setting, at least that I was in. But we'll monitor this data. We're constantly monitoring it, ensuring that our communities are protected, and then putting in public health measures where and if they're necessary. We have high rates of infection now in the southwest of this province, and we're working aggressively with those health agencies to protect those populations more fully. And we're looking at the data every single day. So anytime there's social aggregation, we get concerned, and we'll continue to monitor the data.
Next question.
Your next question comes from John McGrath from TVO. John, please go ahead.
Good afternoon, Doctor. I was looking at the testing availability in Ottawa at their main Brewer testing center. There are no slots available for tomorrow, 2 slots available for Thursday currently. And, it's entirely possible that a child could be sent home from school today, or maybe not be able to go to school tomorrow because of COVID symptoms and not be able to get a test until Friday at this rate. The province also recorded its highest number of pending tests or tests under investigation since May today. Maybe that's just a one-day blip, or maybe there's something more serious to address. Do you have any concerns about the level of testing, both province-wide and in certain cities?
Well, I know we've strategized to have at least 60 to 70,000 test capability on any given day. So it is disconcerting to hear that there are some backups in some areas of the province. We'll work diligently with Ontario Health, with the testing team, as well as the local public health agency to try to shorten that. We want a 24-hour turnaround time in tests, a 24-hour contact time by local public health. Those are important metrics for us, and a delay in testing is disconcerting to me. So we're monitoring this on a daily basis. I've heard of issues in other regions of the province as well, and we need great cooperation between Ontario Health, local public health agencies, our hospital partners, and the lab system. We need to keep as short a time frame on the time to the test results to the individual and to the health unit, and we're monitoring that metric very closely. Any issues across the province, I think we're able to ramp up fairly effectively once any problem is identified.
Follow-up?
This is now the second fall in the school year with COVID, and I hear from a lot of parents who feel like they're going a bit nuts, that it is at least as difficult to get a timely test for their kid this year as it was last year. Is the government considering the use of rapid testing in schools? I know you said that you don't want to go there until potentially case rates get higher because you're worried about false positives. But even a rapid test is better than a test that you have to wait 3 days to get.
No, really good question, John. So if this individual is a high-risk contact of someone with COVID, we absolutely need a PCR test for those individuals. We need the highest sensitivity and specificity of test. Rapid tests, I do see a role for them, and they're for screening of asymptomatic individuals who are not high-risk contacts. So we have to separate out what test works in what environment. The asymptomatic testing, we're reviewing best practices globally, nationally, provincially, and are looking at a strategy where they could be implemented in incidence cases where you have a community with a high rate of illness, let's say Southwest Ontario. We want to keep the schools open, and rapid test would be a means by which we could confirm that children going to that school are not carrying the virus, and it would be used in that instance to build confidence that children can attend the school, to confirm that they don't or are not carrying the virus, and that the school can stay open. So there are two different tests for two different strategies, and we're looking at all testing components that will help our system, our schools stay open, help detect cases, but also build confidence that schools can stay safe and open.
Next question.
Your next question comes from Rob Ferguson at the Toronto Star. Rob, please go ahead.
Hi, Doctor. I'm just trying to get a better handle on where we are. It looks like the 7-day average has kind of plateaued the last week or so. Hospital numbers are okay. I think ICU numbers are actually maybe down a little bit. But we're seeing way more cases in schools than we did at this time last year. So are we in a lull? What do you think is going on? You predicted a difficult fall and winter ahead. So any thoughts on where we are right now would be helpful.
No, you've summarized a lot of the testing numbers and positivity numbers very well. Our system in Ontario appears, and I'm knocking on wood, it's so important to be humble in front of this virus that we know wants to spread very rapidly in our communities. At present, our case counts remain stable. Our hospitalizations are relatively stable. Sadly, we still have around 170 people in the intensive care unit. A vast majority of them are requiring to be ventilated, so to be paralyzed and ventilated. The vast majority of those cases and hospitalized in ICU are in unvaccinated individuals, so it's continuing to be a pandemic of unvaccinated people. The good thing is that the percentage of unvaccinated people in Ontario continues to shrink day by day as all of our local public health agencies and pharmacies and physicians work diligently to try to get that last mile strategy in play where we're maximizing vaccination across Ontario. So we're in a good position at present, but very important to be humble. We only have to look out west to see when you let your guard down, this virus wants to take off explosively and spread. The western provinces have rates of hospitalization 3 to 4 times ours, as well as in the intensive care units. So I'm confident we're on the right track, but I'm humble in front of this virus, and I'm asking all Ontarians to continue to remain vigilant. You are doing the right things. You're getting tested if you get symptoms. You're coming forward and getting immunized. You're protecting each other by wearing masks and practicing good hand hygiene. It's working for Ontario at present. I have confidence we can stay on this track, but we all must remain vigilant.
Follow up.
Thank you, Doctor. And just to get back to what you were saying in an earlier answer, I think it was to Randy. You were talking about other avenues for vaccination and talking about healthcare workers. I know that the ministry is collecting data on, for example, on vaccination rates in long-term care homes. Do you think from what you have seen so far that you need to do more on that front?
We want to look at what long-term care facilities have low immunization rates and how we can work more closely with them to further protect their workers who remain vulnerable to be hospitalized or admitted to intensive care units, as we've known, and or transmit the virus to their families or in the workplace. So this is a setting that we have to learn from wave 1, 2, and 3 that is exceptionally vulnerable, that we need to protect the patients in that environment, give them the respect and proper care that they deserve. And part of that respect and proper care is that everyone around them should be immunized. We'll work with the institutions to try to maximize immunization, but if we're not achieving the immunization rates required to protect the vulnerable, we may have to look at stronger policies. That would be true in the acute care sector, and we've seen some hospitals, like pediatric hospitals, that care for vulnerable children under 12 years of age who cannot be vaccinated, have put in mandatory vaccination policies to protect their patients and their families. We will leave no stone unturned to protect those that are vulnerable in our communities and embrace prevention as the means of getting through this pandemic.
Next question.
Your next question comes from Derek Dianarian from CBC News. Please go ahead.
Thanks. Dr. Moore, my apologies if you've answered this already, but just to be clear, with the proof of vaccination program kicking in tomorrow, what do you think the effect will be on the number of people getting vaccinated?
I think it'll increase the number of people getting vaccinated. It may not have sunk into some individuals that you may not be able to go see a football game, baseball game, hockey game unless you're vaccinated, or go indoors in a restaurant or a bar or a nightclub or any other environment that is outlined in the Act. So it may take time for it to sink in. And I do want to reiterate that we will have a progressive enforcement of this certification validation process starting tomorrow. I ask all Ontarians to be kind and considerate, understand this is something new to all of us. When masking came in, universal masking in Ontario for public spaces, it was new. There were some issues, but we overcame it, and now it's a standard of behavior for us to wear masks on a subway, on a bus, or in public closed spaces. It'll become the same for this validation certification process, but let's be patient, let's be kind with one another, kind with the hostess or the frontline worker who's trying to validate. It's going to be new to all of us. And know that it'll be a learning curve for businesses and individuals as we adopt this as our new strategy to protect ourselves going into the fall and winter.
Follow up.
And what makes you think the proof of vaccination program is going to make any difference in persuading people to actually change their minds if they haven't had a shot yet in all the time that these vaccines have been available to them?
Just looking at the population that has the least protection right now, it's the 20 to 39-year-old population. They have the highest rate of infection. They have still are getting hospitalized as a result of infection and a lower rate of immunization. I think that age group that likes to go out, that is naturally social, that takes advantage of bars, restaurants, nightclubs, I think once it clicks in the coming days that you must be vaccinated to get inside, that will change behaviors. That's my hope. We certainly want them better protected and immunized as we go into the fall and winter, and I hope we get to see a steady rate and rise. I keep comparing ourselves to Quebec. That's around 88%. I think we can get 3% more from this policy initiative to better protect those high-risk environments. And there's no reason why we can't achieve Quebec's rates of protection. They have had a similar process, a very similar verification tool, and I think we can achieve those same rates.
Last question.
Your last question comes from Adrian Gabriel from City TV. Adrian, please go ahead.
Thanks so much for taking my question. Aside from encouraging people to go out and get a vaccine with the rollout of the vaccine certificate program. How are you planning to track whether or not the vaccine certificates are working as a public health measure to reduce spread? Some bioethicists believe we may never know how well they work, if they work at all. And this might be a massive social science experiment that could have lasting impacts on the social fabric of our society.
Well, just to reiterate, this is a temporary measure, given that we knew going into the fall and winter that the risk of COVID, the risk of transmission as we move indoors goes up. So it was a preventive strategy to protect those environments, to limit the number of outbreaks that we've had in those settings. And we have good evidence that outbreaks do occur in nightclubs, in indoor settings. We think it was an essential public health measure to protect those environments, to minimize outbreaks, but also protect those businesses. We all need a balance between the social, mental, physical, and economic well-being and harms caused by the pandemic. And none of us wants to go back in lockdown or shut down once again. So this, I think, is a balanced response. It's proportionate to the risk as we head into the fall and the winter. It is to protect individuals. It's actually to protect unvaccinated individuals, because as they aggregate, they're the ones that have the highest risk of getting admitted to hospital and or into the intensive care unit. So it has multiple purposes. I do think it will be effective, and it will be time limited. These public health measures are to get us through a difficult fall and winter, which we only have to look around Canada at present. Could happen to Ontario at any given time. In many ways, in a pandemic, you learn as you go, but to me, this is prudent, it's proportionate, it's responsible, it's reasonable, it's cautious, and it will keep our businesses open and keep people who go to those environments safer.
Follow up, and this is the last question.
When it comes to the businesses and keeping them open, almost every business I've spoken with who will have to, roll out this vaccine certificate program for customers to enter their business, whether it's a gym or a restaurant, they're all saying that they hope that this program will allow them to have more people inside. There's a gym today who, they're still at 50% capacity. They're saying, if everyone's vaccinated inside, then can we not increase capacity so that we can try and recoup some of the massive losses they've had over the last year plus? Any idea on when we might be able to open that up for them?
Yeah, I'm very sensitive to the unintended negative consequences this pandemic has had on businesses and our economy, and hence the reason I think we need a balanced and proportionate response. What has been the tradition in Ontario is that we've been slow and cautious and measured effect. And if we see that the vaccine passport is working, that it's being adopted, that people are patient and kind and considerate, and it's working to keep those environments safe, that then we can open up more fully. Clearly, those are government decisions. I can provide advice to government, but the government is the final decision maker on maximum number of people allowed in any particular situation. But I believe they have been very prudent, have been monitoring data closely, and it may take us a couple of weeks of the implementation of this to see that it's remaining safe, that we're not having outbreaks in those settings, and that the numbers can be expanded. But I think they're very sensitive to feedback from the business community and don't want to see additional harms done to them. And hence this policy, I think, does support businesses staying open in a prudent and reasonable way.
Thanks, everyone.